think we had a lot of time to just sit and think and be alone. And I think a lot of emotions arose out of that time of loneliness. So I think that's why we're seeing an increase in depression and anxiety. Hi, I'm Kate Antonucci. I am an associate therapist at Clear Behavioral Health. I graduated from Pepperdine University in 2024 with a degree in clinical psychology. A big trend that I see both in adults and teens is depression and anxiety, feelings of overwhelm, feelings of isolation and loneliness, a deeper desire to connect. I think that people are becoming more aware of how their childhood has shaped them, and they're looking to dig a little bit deeper into their experience and their emotions tied to their childhood. So depression and anxiety are definitely two big trends that I've seen in many of my clients. I feel like people are dealing with depression and anxiety more, and I personally think it stems from COVID. I think we had a lot of time to just sit and think and be alone, and I think a lot of emotions arose out of that time of loneliness. So I think that's why we're seeing an increase in depression and anxiety. I think some triggers that can be attributed to people's depression and anxiety include a death of a family member, divorce, a lot of isolation and loneliness. I think a lot stemming from people's childhoods come up in therapy. I think that even though as a society we are very connected via social media, I think it can also be a very isolating experience, which has led to people actually feeling disconnected. And so I hear a lot of that in session of how people are feeling very lonely and feeling very disconnected from friends, from family, and from society. And I think that contributes to their depression and their anxiety. Real support to me looks like consistent, judgment-free presence. It looks like someone who's walking beside you, who's not trying to fix you. They're just there to listen and validate your feelings and your experiences. Support isn't about giving advice. It's just really helping the other person feel seen, heard, and understood. It helps create space for someone to move through struggle without shame. One of the most common mental health issues I see in teens today is anxiety. This can often show up as irritability, laziness, sleep issues, stomach aches, headaches. They're under a lot of pressure from school, their parents, their friends, social media, and themselves. Sometimes it can look like laziness or anger, but what's underneath it is really fear and overwhelm. Clear uses a holistic approach because healing is not one-dimensional. We focus on the mind, body, and relationships, leading to more lasting growth. We offer medication management, we offer TMS, we offer individual and group therapies, as well as community and support. It's about building long-term resilience, not just temporary relief. Questions I would recommend asking your therapist in your first therapy session is, what are their credentials? What is their style? What do they focus on? And do they focus on something that you're coming in to work on? I would ask about their payment. So do they take insurance or are they out of pocket? I also would see if you're a good fit with them. The client and therapist relationship is one of the most important aspects of therapy. When you have a good therapeutic alliance with your therapist, it will lead to more lasting growth. Clients can just feel if their personalities are a match or not. Sometimes you can just feel it. It's like an energy. You just click with someone, or sometimes you just don't. I would make sure that the therapist has the right experience and background and training to work on whatever you come presenting with to therapy. But in terms of a good alliance, I really think a personality fit is really important. And I think that's something that you can gauge in your first couple of sessions to see if it's the right fit. we have come a long way in destigmatizing mental health treatment, even though I think that we have a long ways to go. I think that if you're nervous about what the stigma is, you don't necessarily have to tell anyone. If it's something that you want to do, you can keep it confidential to yourself. Therapists hold what you say in session confidentially, unless like a mandated report is needed. But in terms of the stigma, I feel like we've come a long way as a society in accepting that mental health treatment is really important, just as equally as important as, let's say, going to the doctor, treating your physical health. So I think that if you're having anxiety or worries about attending therapy, that's something that you can keep to yourself, or kind of be proud of it. You're working on yourself just as you would your physical health. If you feel like you're going through anxiety or depression, you don't have to go through it alone. Reach out to Clear for help.